and welcome to yet another interesting and educated episode of Nosicola Health and Lifestyle YouTube channel. You already know what we do here. It is all fun and learning. Yes, so on today's special episode, I'm going to be treating what I tag frequently asked medical questions. Yes, pardon my husky voice, I have rhinitis, that's up. Now, I'm looking all beautiful. I know, pain girl. Yeah, Shiri, our makeup pro in Canada did this. If you're anywhere in Canada and you want, she's available to travel, you want your makeup done, like, look at this, since money, and I still have this almost midnight. Oh girl, you're on fire. Then you should contact Shiri, our makeup pro. I'm gonna drop a handle in the link. Now I'm gonna be treating frequently asked medical question. The first thing I'd like to talk about today is the issue of infertility. Now, I get a lot of questions, people asking me, I've been married for so year and I'm not pregnant. This. First, I'd like to tell you, please relax. Calm down. Your baby will come. Because I'm not here to give you an antidote to infertility, but I'm here to open your understanding about some things. Now, in medical practice, before you can say a woman is infertile, she must have copulated with a man. She must have been with a man. Active sexual intercourse with a man for 1 year, not the one that, oh, he came home 3 months ago and he traveled again, he came home 4 months ago and he traveled again, we meet once in a week. She must actively engage in sexual activity with a man for 1 year. If nothing happens, then we can now say she's infertile. Then we'll start treating that. But I'm not, I get it as human being. We're not patient to say, oh, what can I wait for 1 whole year, 6 months, 8 months without a child, and you want me to, I understand all that, but you're going to put yourself under a lot of pressure when you think, when you keep thinking about it, because the body works like a machine. So now when you subject yourself to undue stress, like, oh, I don't have a baby yet, every day you see your period, you're sad, your blood pressure is going up, your body is undergoing stress. So let me tell you what happens. The body works like a machine. Now your body calls the organ, your body calls the kidney, calls the heart, calls the reproductive organ, calls the ovary, calls the midterm. And your body says, so yesterday, Mrs. Olalumpe came home tired, her blood pressure was up, and she's not in a good mood, she was just sober all through. What do you think we should do? The heart will say, I'm still pumping. The kidney will say, oh, we're still good. And then the brain will say, this is what we're going to do. Reproductive organ, she doesn't need a baby now. Reduce your production of follicle stimulating hormone, reduce your production of luteinizing hormone. Then the brain will now signal to other organs, release more cortisol, release more adrenaline, because that's what she needs now. We need to arrest the stress that she's going through first before we can say, let us give her a child. Because if you are producing a lot of follicle stimulating hormone needed for a good menstrual period and all that, for you to ovulate and all that, then are you sure she'll be able to carry a child? She's stressed. That is why you should not stress yourself, because by the time you do, the body adjusts itself, balances itself to what you are experiencing. So I get it. It's not easy, but try to relax, try to calm down. Your baby will come. Make love on your ovulation days, pray to God, relax yourself. And then another one like it is women that says, I have breast milk discharge from my breast, but I'm not breastfeeding. That is galacturia. And if you watch my other video, I spoke about it already. We have expressible galacturia and non-expressible galacturia. Sorry, let me bring this forward to myself. So if it is expressible galacturia, likely that is the one that you have to press your nipple before the milk discharge comes out. If it's not expressible, then it is pouring on its own, and that is one that is much more dangerous. But if it's expressible, I have experienced expressible galacturia before firsthand, and I still had my child. I didn't even take any medication. I wanted to. I saw my family doctor and he was like, if some people experience this, I think you should just relax yourself, and then don't worry about it. And that's what I did, and it just went on its own. So if you have it, no cause for alarm, no cause to panic. But if it's expressible, please see your doctor immediately, because that might be that you have a cancer, a tumor of the pituitary gland. But if it's expressible, then you can still watch it. And for women who have expressible galacturia, please, their husband must take note. If you are married or you have an active engagement with a man, that you cannot fondle a breast or suck it at that time if you are looking for a child, because you are going to be making her to produce more prolactin by the time you suck. When a baby, just like when a baby sucks the mother's breast, when a baby sucks, as the baby sucks, prolactin level increases, milk production increases. So it's synonymous. So if you keep sucking her breast and she's expressing galacturia, you are not doing her any good. And you're also looking for a child, because ovulation, that's why you see some women say they have lactational amenorrhea. It means that when they are breastfeeding their baby, they do not menstruate. And what happens is that when you don't menstruate, there is no pregnancy. Some people use this as a family planning method. So that is what happens. If your wife is having galacturia, there is probability that ovulation is not sitting down so well. It's not sitting down so pretty the way it should be. And they are now sucking more, then the brain is getting the signal that, oh, we need to produce more prolactin. As it's producing more prolactin, she may experience amenorrhea, no menstruation, no menstrual period. Yeah, however, this kind of couple may need more tests. Now, another one that is more like it that I would like to talk about is the menstrual period. You know, a lot of people will come and ask me, oh, no, so fella, my period this month, it was scanty, it didn't come the way it used to come, and blah, blah, blah. Now, there is something I want women to take note of. You must know yourself. Before you complain of any medical condition at all on planet Earth, make sure you know yourself. It helps doctors and nurses a lot when you know yourself. For example, I usually have every period. I use 4 to 5 pads in a day standard, and I bleed for 5 days. That's my standard. 4 to 5 pads in a day standard. That 4 to 5 pads does not mean, I don't mean it scantily soak. It soaks a lot. Under 2 hours, my pad is full, and I have to change it. That is my body. In fact, sometimes after my menstrual period, I usually have low blood volume, and I have to start eating well, you know, taking hematinics to boost my blood level. That is just who I am naturally. It does not mean that anything is wrong with me, because I've done tests and I'm okay. But if somebody else that usually have scanty menstruation, I have a friend, by the time she's menstruating, she doesn't even use sanitary towels. She just goes on a normal, because it's just like a drop. It just keeps dropping like that, and she's good. Such person, if she has a heavy flow, now starting to use 4 to 5 pad like I'm doing, someone that doesn't use pad before, then she needs to see the doctor. That is when she can now say, I have a heavy period. Or someone like me, if I now have scanty period, I might not get bothered, because if it's still coming, I'm good. I might not get really bothered. But if it now increases more to the fact that this is not huge. So before you can say something is abnormal, what is your normal? You should know your normal as a human being before I can come and say, oh God, this month I have an abnormal period. What is your normal? That's why everybody should have this app. There's one I use. They call it my period counter or something like that. I saved, because you can change the name of the app. I saved it as my calendar on my phone. You can check. There are a lot of menstruation app on the Google store. Just browse it so that you can. It's very good for you to have a reference, a track record of your menstruation. I have 2 years track record as I speak. So if you don't, so I understand that as women will forget this thing. Like I went to last week, say maybe 14, maybe 15. You're just, but if you have that tracker, just go there, check it. And then we can also, okay, this is abnormal for you. So before you can say something is heavy or light, you should know your normal. You should know your pattern. You should know how many days you bleed for. You should know if it's usually dark red or usually very red or something. You should know the pattern. That is where we can now say, okay, this is abnormal. Because when people come to me and I ask them, okay, what is your normal? They don't know. Or when I ask them, okay, can you tell me, give me history of your menstruation in 3 days or in 3 months or 4 months? They don't have it. So what do you want me to use as a baseline data? Like, how do you want me to judge that, okay, for her to have this? Because when you come to me and you complain, I don't just prescribe or something for you. Or if you're my family member or something, even if I don't just say, okay, use this and do drug. Because normally, number one, I'm not even licensed to prescribe drugs for anybody, except, yes, close family member and all of that, which is understandable. I ask for your medical history first. I want to know your history before I can say, okay. So when a woman says, I have abnormal menstruation period or it's smelly or something, what is your normal? That's when I can now say, oh, this is abnormal. So it is very good that we know our normal. And the normal menstruation period, it can have clots, but it should not have a lot of blood clots. If you had a lot of blood clots, like big blood clots, report to a doctor. It could mean that you have experiencing a spontaneous abortion. Maybe if you're being with a man, you know, and sometimes a lot of people do not know these things. They just feel, oh, it just came like that. Don't, anything that has to do with your body, be very careful with. Don't just say, it just came like that. No, please, don't. Because when you have retained product of abortion, retained product of conception, God forbid you have it and you don't know, it can lead to peritonitis, can lead to infection, can lead to a lot of things. So it's better that you always know your normal from the abnormal. You have to know your normal before you can say, okay, this thing is abnormal. Another question that I would like to treat with people, that a lot of people ask me is, oh, I have vaginal discharge, I have vaginal itching, I have vaginal this and that. Now, please note that the vagina discharges normally. Normally, biologically, you should have vaginal discharge, but it should not smell, it should not itch, it should not be fishy odor, or it should vagina has odor, it has its own unique odor. So when somebody tells you that, oh, I have a cream I bought on Instagram, it's to make a vagina smell like rosemary, or like cayenne pepper, or atarodo, or agbalumo, don't answer them. There is nothing like that. The vagina has its own odor, but it should not be foul smelling. The vagina has its own unique scent, but it should not be foul smelling. And it should not itch you. If vagina is itching, or you're experiencing burning sensation upon urination, then something is wrong. And you should take a test. You can do a vaginal swab, you can do urine culture. Take a test. Don't just use drug indiscriminately. Don't say, I'm going to take a shame that time. They gave me one drug like that. You should use it. No. When that thing happened to me, my doctor gave me, no, don't do that. Don't do that to anybody. Allow them to seek medical help, and let us give them the best treatment that is best for what is happening to them at that time. Now, a lot of times we do more harm to ourselves than good, because in a lifetime, at least a grown-up woman will experience vaginal infection at least once. As in, that's maybe at least twice or 3 times because women, I've said it in my other video, women have shorter urethra, men have a longer one. So the shorter urethra that women have predisposes them to a lot of this infection, and that's why you should take care of yourself as a woman. Now, when you are giving antibiotics, if you make a mistake of not using antibiotics regularly the way it was prescribed, that can even make you to have more infection than you had before. Please take note. It is very important that you exhaust the antibiotics. If it's for 5 to 7 days, I know it's not easy. Set an alarm. 10 a.m. Usually antibiotics are taken every 12 hours. Set an alarm. 10 a.m., 10 p.m., 9 a.m., 9 p.m. Use your drug. 5 to 7 days, completely done. Know that you are done. But if you do not complete it, let me tell you the implication of not completing your antibiotic. The implication is that something happens now. Just imagine that, you know, when anything happens to your body, the WBC, that's white blood cells, they fight infection. Now, what they do is when the infection is beyond them, that's when you start seeing signs and symptoms externally. But usually, they try to curb it. It is when they cannot that you start seeing the symptoms externally. Now, this is what happens when you take antibiotics. Just imagine that what was happening to you was like this before. You took antibiotics, right? These antibiotics you are taking 9 a.m., 9 p.m. By the time you take this antibiotic, there's something we call blood level. By the time you take it at 9 a.m., it disrupts the colony of the bacteria. They keep reducing. They reduce to this. By the time you take it 9 p.m., it keep reducing. They can reduce to this, maybe after the 7 days. When you're exhausted, they can even, like reduce totally. Now, imagine you took it for just 3 days, because usually you will experience relief after taking it for 2 or 3 days, and then you stop taking it. So probably this is what we had left before, and they stop taking antibiotics. You know what will happen? The colony of the bacteria, they will do their meeting and say, yesterday she took her drugs. Today she didn't take it though. They will now go and reinforce more. They will go and gather more power. People that were using 1 gun to shoot you before, they start using 5 guns to shoot you at the same time. Then they gather more power and they can become like this. So by the time you're not complaining of the same, I said, doctor, I paid my drug, I paid 50,000 in this hospital, and you people gave me crap. And then you are back again with the same symptoms, or even worse. And the doctor asks, how many days did you take your medication for? Oh, just 3 days. It's not 5 or 7 days. Oh God. So this time around, let me tell you what happens. The implication is that the drug we gave you first will not work for this thing again, because these bacteria would have grown stronger and would have grown resistant to that medication. We have to try you on another medication. God help you. The other medication we give you, or we gave you, you did not use it again. Do you understand? You didn't complete it. You didn't complete the medication. God help you. Now, you know what's going to happen? That's how you give growing resistance to every medication. And that's why some people, when they tell them to do cultural and sensitivity tests, or do like carry out a test or something, they discover that they have growing resistance to all the medication, maybe just 1 or 2. So that is the implication. Make sure to use your medications as you should. So another question I'd like to treat is the issue of breastfeeding. A lot of people ask, oh, when I had my baby, I didn't breastfeed in past in 2-3 days, blah 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 blah. It happens. It is not unusual for you not to breastfeed and for you not to have a milk production the first 2-3 days that you have your baby. Do you understand? But allow the baby to keep sucking, because the colostrum is going to come out and you will not know when, and the baby needs this colostrum very well. So allow the baby to keep putting the baby to the breast until the milk comes out. So that one is not the only thing, that you're going to experience slight pain while breastfeeding the child. You can get this medulla cream. I don't really know the name. I'll take a picture of it later. You can apply it to the nipple. It works really well and it's safe for the baby and for the mother. So everybody wins, you know. So if you have I don't know, I think I've exhausted my question, but if you have more questions that you feel I have not treated, please kindly drop a comment for me or send me a direct message, and I'll be willing to tackle your questions. And I'm glad we all had fun. I hope you all had fun. Yes, if you are yet to subscribe to my YouTube channel, please kindly subscribe. Help me to spread the gospel of health education, like I usually say it. You know, I do these things out of the passion of my heart. Help me share my video, send it to your friend, tell them to subscribe to my YouTube channel. That's how you can help me grow. I love you all. Thank you so much. If you are just joining for the first time, thank you so much for watching this video. I hope that I'll see you some other time. Bye. So if you're anywhere in Canada and you want beautiful makeup like this, please contact at Ashiriwa Makeup Pro. I'm gonna drop a link down below on Instagram. She's really good at what she does. And please subscribe to my YouTube channel. See you. Bye.